bad or poor oral hygiene.
Yeah.
So fine, if you have mouth odor, yes, fine. If you are, even though you have a mouth odor, and you know you've tried your best in keep brushing your teeth, then you've gone for scaling and polishing, you still believe you have mouth odor, I don't think so. Because it is the dentist that will figure it out. Truly, you have a mouth odor or not. There are still cases whereby I've seen patients where they present them so that they presented as if they have mouth odor. They will telling me, I have mouth odor, I have bad breath. I'll be like, let me just smell it. Let me just examine if truly you have mouth odor. And I will find out that there is no mouth odor.
Wow.
But of course, the feeling that maybe when they have not, maybe it has happened to them one day like that they did not brush their teeth after eating in the morning, and they held something heavy in the morning. And during the day, by 4 p.m., they didn't eat anything. Of course, some people that do sedentary job, all those office work, they did not speak to anyone throughout the day. So they are now trying to speak around 4 p.m. What do you think will be happening? They will be feeling like they have mouth odor. Whereas they don't have mouth odor. It's as a result of the fact that they did not brush their teeth after eating in the morning. So that is what is about mouth odor. It could be psychological in a sense that the feeling that somebody has already perceived that I have bad breath one day like that, and you are trying to speak with another person. You want to close your mouth like, is my mouth smelling? You know, it's kind of psychological like that. So it's multifactorial, so you can go ahead. I think I've done justice to that.
Yeah. Okay. So you also talked about scaling and polishing. You said the dental will help you do some things to remove food that has been there over time. The shall polish the teeth. Okay. Yeah. So the stability of the teeth with the gum. You said there's a disease that actually causes the teeth to be shaking. So are you saying that all those people who have tooth loss, even older people, adults that are having tooth loss and pain, is because of the periodontitis? I don't get how you call it. Periodontitis. Okay, periodontitis. Is that?
Yes. Yes. So the thing is, the question you just asked now, I understand it.
Okay.
Fine. It's not all tooth loss that are due to periodontitis.
Okay.
Don't misunderstand that. Some tooth loss are caused as a result of maybe trauma, like injury, or maybe tooth extractions. Maybe the patient has dental pulpitis as a result of dental caries. So, tooth loss could come in a lot of ways. So maybe the patient has dental caries, has had a previous history of extraction. Of course, that is a tooth loss. Or periodontitis, the tooth just started shaking. Maybe after a long period of time, the tooth started shaking, and after that, you still don't do anything to it. The tooth can get lost. It could just remove, and its pathology is non-normal. So exfoliation is the normal form, is a physiological way of tooth loss. In a sense, fine, it will be replaced. It will replace itself. Exfoliation is a process of trying to like the primary tooth trying to wear off, like go away, like exfoliated, got removed from the body, so that the secondary tooth will come, permanent tooth will come off. Do you get? It's the permanent tooth that will push the primary tooth away. You know, primary tooth doesn't have the true roots, so it's the permanent tooth that is growing up that will push the primary tooth away, so it got exfoliated. So if it is not due to exfoliation, any other form of tooth loss is pathological. So it could now be as a result of periodontitis, or as a result of irreversible pulpitis, or previous history of trauma. So that is it.
Okay.
Yeah,
okay.
Thank you.
Okay, so it's not only as a result of periodontitis, other things can actually cause it, like previous history of tooth loss, injury, all those kind of things. Not only periodontitis, like you said.
No, not only periodontitis.
All right, that's very good. Okay, so I want to ask this question as regarding the brushing of teeth. Most times you see people brush their teeth, and they brush it to the point whereby you see this stain of blood, sometimes blood coming out from the mouth. And it's not that it's real blood, though. Of course, you'll be feeling pain in your mouth, but then people brush their teeth such that the thing that they spit out, you see stains of blood or colored red stain. What exactly is causing that? And is it because of the way the teeth is being brushed? Is that what's causing it, or any other thing?
Thank you. I love the question. Let me start answering the question from the aspect of what usually cause gum bleeding. What you just talked about is called gum bleeding, and gum bleeding can come as a result of gingivitis. It can also occur as a result of bad pattern of toothbrushing. You know, some people let me first explain the toothbrushing aspect of it. You know, some people when they are brushing, they'll be brushing hardly, using hard brush. They will not be brushing with so much pressure that the pressure will be too much on the gum. Fine, the bleeding will definitely come, especially when the patient is using hard brush. So bleeding will come. But if the patient is brushing in a normal way, normal condition, standard way to brush, and aside that, the patient is using soft brush, and still the patient is having toothbrushing, it is basically gingivitis. And gingivitis is caused as a result of accumulation of the plaques and calculus on the junction between the tooth, the crown of the tooth, and the gum. You know, on a normal day, if there is no plaques or calculus accumulation between the crown of the tooth and the gum, the air space, there's a very micro air space between the gum and the roots and the crown. So that air space will allow air to flow through into the gum. Like there's an exchange of air between the outside, the external environment in the mouth and the gum. So if that exchange of air is being bridged or being stopped or being how will I call it? How will I put it? It's been trying to it's being stopped. It's being altered by the calculus. A prayer will build up in the gum. You know, of course, increase in volume will lead to decrease in pressure. So that law still applies to heat. So there will be loss of equilibrium. So fine, the prayer will build on the gum. Any little attempt to brush will cause bleeding. It will just be like fine. Just imagine you have a nylon, you pour water on that nylon, the nylon has already swollen up due to the excess water in it. You now try to apply something tiny on that nylon, it will break. The water in the nylon will start coming out. Same thing applicable to gingivitis. So it's as a result of calculus majorly that causes tooth brushing, bleeding, gum bleeding, not due to trauma or a bad way of brushing. So it's gingivitis. It's gingivitis. So it could be prevented by scaling and polishing. Do you get? So it's just as if you scale the tooth by picking out the remnant or by picking out the calculus. Fine, you've already created the atmosphere for the exchange of air between the external environment and the gum.
Okay, so anyone out there who is actually facing these issues, please, just like my guest just said, it's gingivitis, and it will be done, it will be prevented, it will be sorted out when you go for a medical checkup, dental medical checkup. I think recently this week I sent out the link to one of our podcast episodes on medical checkup. We are in this part of the world whereby, especially in this place Nigeria, whereby people talk down, people look down so well on medical checkup. So please, it's very important that you go for dental medical checkup, like my guest just said now, at least once in 6 months, in order for them to help you remove all those food remnants over time and prevent issues concerning the teeth. Okay, so please, are there other problems that you think lack of care for the teeth can cause, apart from the ones that has been mentioned? And and also, sir, can all these issues be more dangerous? Like, can they be dangerous? Is it only about the teeth? Can any issues like problems, health issues, are there health issues surrounding the teeth that can actually affect the whole body that maybe can lead to death if not taken care of, or something like that, sir?
Yes, I love the question. Yes. Let me just cite an example. In the case of a patient that has periapical abscess. Yes, periapical abscess. That periapical abscess is caused as the result of infection. Fine, a patient is trying to brush his teeth. In that process, the brush, there's the tiny, all those tiny brush, like individual tiny brush, now try to prick. It now pricked on the gum. So when it pricked on the gum and got infected, swelling will start coming up, even without tooth infection, without dental caries or anything. Swelling will start coming up gradually after being infected. So that could progress to Ludwig angina. So it's gradually progressing to tumor of the mouth, of the oral cavity, which could be so large to the extent that it could cause cause blocking of the airway, and after causing the blocking of the airway, of course, that's death. Do you get my point?
Yes.
So, are you with me?
Yes,
is it clear? That is it. Hello?
Yeah, we are here, sir. Continue, sir.
Yeah. So that is one. Then another thing is a patient that has irreversible pulpitis as a result of dental caries are not getting it treated at a point in time could also progress to Ludwig angina, then gradually to tumor. So then another thing is just imagine there is a trauma and there is mandibular fracture. So fine, if a part of the mandible got fractured, the patient doesn't get it treated, it doesn't go for way out, and eventually the fracture could get infected and could lead to blocking of airways majorly.
Yeah.
So, and recently it has been proved that there's a particular oral health issues that could lead to endocarditis. That's a disease of the heart. So there's a kind of relationship that happens between the microorganism in the mouth and the ones in the heart. So it is that microorganism that actually progress to the heart that could cause endocarditis. So it's kind of related. So of course, oral health is actually a major pathway to all the body system. So anything you take through your mouth will affect your body. So any kind of seriousness or attention you pay to your mouth, you are paying it to your body, to the part of your body. Fine, if a patient has an irreversible pulpitis, the patient will break down. Some patient could come with earache. They will be telling you that as the teeth is paining them, their head is paining them, their ear is paining them, everything is paining them, they are not fine. They are not really, they will not be trying at that period. So of course, here oral cavity is a very important part of the body, and that is why dentistry has to stand on its own, because it's a very complex area or part of the body. So it's just like that.
There's actually a reason why I asked that question, because most times there's some part of the body whereby we don't really pay attention to, like let me just wake up in the morning, let me wash my teeth and go to work. You don't really, people tend to not pay attention to all these part of the body, like eyes, teeth, Shebi is just for me to wake up and open my eyes. What's so special? What do I need to do? I don't need, most times if something does not happen to you, sometimes you even go and say you want to go and get eye drop, not to talk of going to the hospital because of eyes. So that was why I asked that question, so as to make my listeners to understand that the teeth is actually a very, very important part of the body, just like the stuff you mentioned now, endocardiatics. You were saying that the microorganisms in the mouth can progress to the heart and actually affect the heart. This is to show you that you can't just take your teeth with less importance. You get. So please and please, my listeners out there, please, we want us to take we need you to take your teeth very, very important. Your teeth care, ensure you take it important. Even if you've not been doing that, please, this is the time